What imaging is used for emergency stroke diagnosis? Imagine suddenly experiencing weakness, confusion, or trouble speaking, and every second counts. When someone shows signs of a stroke, quick imaging tests are essential to find out what's happening inside the brain. The main tools used in emergency settings are computed tomography scans and magnetic resonance imaging. These tests help doctors determine whether the stroke is caused by a blood clot blocking blood flow or by bleeding in the brain, which is vital for choosing the right treatment. The first and most common imaging test in an emergency is the non-contrast computed tomography scan, often called a CORT scan. It is very fast, usually taking just a few minutes, and is widely available in hospitals. The CORT scan helps doctors quickly tell if the stroke is due to bleeding or a clot. Bleeding appears as bright or hyperdense areas on the scan, which makes it easier to spot. This distinction is crucial because treatments like clot-busting drugs are used only in ischemic strokes caused by clots, while bleeding requires different care. While the CORT scan is excellent at detecting bleeding, it can sometimes miss very early signs of ischemic stroke, especially within the first few hours. Early ischemic changes might include subtle loss of the normal difference between gray and white matter, or a hyperdense vessel sign indicating a clot inside an artery. Because it is quick and accessible, the CORT scan is often performed within the first hour after symptoms start, helping doctors make fast decisions to save brain tissue. Magnetic resonance imaging, or MRI, especially diffusion-weighted imaging, offers more detailed pictures of brain tissue. It is highly sensitive in detecting early ischemic strokes, often identifying damage sooner than a CORT scan. MRI can also distinguish between ischemic and hemorrhagic strokes and show the extent of brain injury. Additionally, perfusion MRI can evaluate blood flow in the brain, helping identify areas that might still be saved if blood flow is restored. However, MRI takes longer to perform, and not all emergency departments have immediate access to it. It can also be challenging for patients who are very ill or claustrophobic. Sometimes, doctors use advanced CORT techniques like CORT angiography and CORT perfusion. CORT angiography involves injecting contrast dye to see blood vessels clearly, helping identify blockages or ruptures in the arteries. CORT perfusion measures blood flow and volume in the brain, helping determine which areas are irreversibly damaged and which might still benefit from treatment. These tests are usually done after the initial CORT scan if further vascular details are needed to guide therapy. Other imaging options include ultrasound, like carotid Doppler, which looks at blood flow in the neck arteries but isn't used for brain imaging during an emergency. Mr. Angiography is another non-invasive way to visualize blood vessels without radiation but is less common in urgent situations. In summary, the quick and effective non-contrast CORT scan remains the primary imaging tool in emergency stroke care because it rapidly rules out bleeding. MRI provides more detailed information about brain damage and is especially useful for detecting early ischemic changes. When available, additional imaging like CORT angiography and perfusion scans give vital information about blood vessels and blood flow, helping doctors decide on the best treatment options. Acting fast with the right imaging within the first hours of symptoms can make a big difference in recovery and outcomes. Always remember, if you or someone else shows signs of a stroke, seek emergency medical help immediately and trust healthcare professionals to guide the diagnosis and treatment.